Hundreds of protesters marched on the Ontario legislature today, calling on the government to protect residents of the Grassy Narrows Reserve from mercury contamination. Back in the 70s, the reserve was devastated by industrial pollution. And according to those on the reserve, backed by a study released this week, they are still plagued by mercury contamination, nearly 40 years on. Protesters say the problem of mercury persists 40 years after pulp and paper companies dumped some 20 tons of mercury into river systems near the reserve.
What we have done to the Ojibwe people here falls little short of an act of genocide.
The mercury poisoned the fish, and the fish poisoned the people, bit by bit, year by year. Many who were poisoned in the 70s are dead, and many who survived still suffer today.
My whole nervous system is out of whack. I can't barely walk.
Fans received a payout from the government back in 1985, $8,000 a person. But symptoms of mercury poisoning kept showing up in their children and grandchildren.
Everybody said that, this problem was gone, and it happened in the 60s, and then, there's this doctor telling me that, my daughter has, all these medical problems she has.
The Ontario government says the mercury levels are safe. After all that's happened in Grassy Narrows, can Queen's Park wash its hands that easily? Well, my next guest was one of the protesters at that Queen's Park protest today. Judy herself suffers from the effects of contamination at the reserve, and she's been fighting to get government action on the problem for 15 years, and she joins me now. Thank you so much for coming in today. Tell me about this, because this is a real update for a lot of people, and I was familiar with this story when it happened back in the 70s, and was surprised to hear that the legacy was still carrying on. So tell me what mercury is doing to your community today.
Well, actually, Dr. Harada's report is not the only report that confirms that there's mercury poisoning in the water. We've been doing 4 studies with the help of Dr. Leanne Simpson and Patricia Sellers. So we've had 4 studies already, and we've confirmed that. But with the visit of Dr. Harada, it's brought more public focus through his being involved in my community.
Yeah, Dr. Harada, for people who aren't following this closely, is somebody, the Japanese researcher who was there in the 70s and did some testing and has come back to do more testing and is still finding that there are traces of the mercury there. So you carry this in your own body?
Myself? Yeah, I was tested positive for mercury poisoning. Like half of my face is numb, and I use a cane to walk, and I'm on that mercury disability funding. Yeah, I get that.
And do you see other signs of this? Because you talk about the studies here now. Health Canada says it stopped testing for mercury, the fish in your community, for mercury poisoning nearly 10 years ago because their mercury levels were well below federal guidelines. So then we get into the one study versus the other study. So if we put the studies aside, I'm curious to know what you're actually seeing, the effects that you see today that convince you that the mercury is still a problem in your community.
The alarm for me was when a 2-year-old child had cancer in the brain. And to me, that was like a big alarm. And Leanne Simpson helped me to access funding to do studies to confirm that there is a problem with contaminants in our water. And we proved that with the study that we just finished. So there's seizures in babies, and there's thyroid disease with women, a lot of women. In Grassy, I have thyroid disease also.
And are people still eating the fish?
They are. I would say maybe 50% of our people still eat the fish, only because if you ever come to my community, there's lakes all over. And we don't always go into Kenora or Safeway and all that when the grocery store is right outside our door. You can just go down the lake and you can go get fish. And if your cupboards are bare because you're poor, then you can just go down the lake and get a fish and feed your family. So there's a lot of things around that why we continue, and one of them is our, as a people, the Anishinaabe people, like we've always eaten fish. It's not easy to just stop eating it.
Now, the government had offered compensation for people who were affected by this. What more do you want now, or what do you want on top of that? What are you asking for?
Actually, the government never compensated the reserve, the people for that. The paper mill did. And the province actually walked away from the talks, and that was in the early 1990s. And they never did compensate the First Nations for the pollution, the poisoning.
And that's what you were asking for today, then?
That's one of the things, yeah. But there's also other things, is like to say to Canadian society that there is really mercury poisoning happening in the water, and it doesn't end in Grassy Narrows, it continues on into the river system. And there's also like the mills that are still in our area. There's Weyerhaeuser and Dryden Paper Mill. They're still dumping chemicals in the water. It never stopped because there's still the consumer need to buy their products. So there's still chemicals going in the water. It may not be mercury, but it's arsenic, and it's a lot of cancer-causing chemicals going in the water now.
Well, I know the goal was to raise awareness and get people's attention, and clearly you succeeded in doing that, at least as a start, and we'll see where it goes from here. Judy, thank you for coming in tonight and talking to us. We do appreciate it.
Thank you.